Welcome to the Ultimate High-Yield MCQ Mastery Portal and Test Series for Norcet, RRB, and Nclex. This video offers select clinical preparation. We cover targeted nursing pathways like Norcet for central government hospital systems and RRB staff nurse, with content on general science and human anatomy. We also offer Nclex-RN prep, focused on next general licensure and clinical judgment. Challenge number 1. A patient with acute MI is receiving an IV nitroglycerin infusion. Which assessment is the most critical safety priority? The options are hourly urine output, blood pressure monitoring, oxygen saturation, or core temperature. Nitro infusion triggers rapid vascular dilation. The correct answer is B, blood pressure monitoring. Nitroglycerin is a powerful vasodilator, reducing venous return and arterial resistance. This can cause a sudden drop in blood pressure. Continuous arterial line or intensive BP measurement is mandatory. The emergency rule is to hold nitroglycerin if systolic BP drops below 90 millimeters of mercury to prevent coronary perfusion failure, which can worsen ischemia. Challenge number 2. Which clinical sign is the most specific systemic assessment finding in a patient with right-sided heart failure? Options are jugular venous distension, pulmonary crackles, frothy pink sputum, or orthopnea. Right-sided signs are majorly systemic. The correct answer is A, jugular venous distension. In right-sided heart failure, the right ventricle fails to properly collect systemic venous blood, causing blood backflow into the right atrium and vena cava. This venous back pressure generates direct clinical indicators like jugular venous distension, hepatomegaly, and bilateral peripheral pedal edema. Challenge number 3. Calculate the cardiac output, CO, for a patient with a heart rate, HR, of 80 BPM and a stroke volume, SV, of 70 milliliters. The formula is CO equals HR times SV. You must calculate the values carefully in liters per minute. The correct answer is B, 5.6 L per minute. The calculation is 80 BPM multiplied by 70 milliliters, equaling 5,600 milliliters per minute, which converts to 5.6 L per minute. The normal adult cardiac output range is 4 to 8 L per minute at rest. A clinical tip is that tachycardia, or high HR, is a compensatory response to maintain perfusion when stroke volume drops. Challenge number 4. A patient on digoxin therapy reports visual disturbances like yellow-green halos around lights and nausea. What is your priority action? The options are administering the next dose immediately, holding digoxin and assessing serum potassium/digoxin levels, encouraging a high sodium snack, or starting slow, deep breathing exercises. The correct answer is B. Hold digoxin and assess serum potassium and digoxin levels. Visual halos, acute nausea, and profound bradycardia are typical symptoms of digoxin toxicity, which occurs at levels above 2.0 nanograms per milliliter. Hypokalemia increases digoxin binding affinity, leading to rapid toxic effects. Baseline assessment is mandatory for safety. Challenge number 5. During the early compensatory stage of hypovolemic shock, which clinical parameters should the nurse expect to rise? Options are core body temperature and urine output, heart rate and peripheral vascular resistance, pulse pressure and bowel sounds, or skin warmth and cardiac index. The correct answer is B, heart rate and peripheral vascular resistance. The compensatory mechanism involves releasing epinephrine and norepinephrine. This causes vasoconstriction, meaning peripheral vascular resistance rises, and tachycardia, meaning heart rate rises, to help keep blood pressure stable. Let's quickly review the key points. For nitroglycerin, monitor continuous systolic BP and watch for hypotension aggressively. For right heart failure, look for systemic congestion signs like JVD, pedal edema, and hepatomegaly. For digoxin safety, hold the drug if the heart rate is below 60 BPM and assess potassium levels. Success is yours. Keep practicing, keep saving lives. For more high-yield nursing MCQs and concepts, join the Elite Nursing Squad.